Not sure where to start in finding the best health insurance plan for you? Here are the best health insurance companies to consider as you prepare to shop for coverage during open enrollment. To determine the best health insurance companies, the Forbes Health editorial team evaluated U.S. insurance companies that offer plans nationwide by how many states they provide coverage in, the sizes of their provider networks, the types of plans available, their starting rates for physician and specialist copays, and their reputations among agencies like AM Best, which evaluates a company's financial health, and the Better Business Bureau, which focuses more on customer satisfaction. Read on to see which providers made the list. Best health insurance companies: Aetna, Blue Cross Blue Shield, Cigna, United Healthcare. Humana. What is health insurance? Health insurance is a contract that requires an insurer to pay some or all of a person's medical expenses in exchange for a monthly premium. It's to prevent you from hitting financial ruin should you run into an emergency, says Molly Moore, co-founder and chief health plan officer at health insurance startup Decent. Some people get health insurance because they know they have ongoing healthcare issues that need to be taken care of. And some people get health insurance because they're scared of something that could happen that they can't plan for, she says. Going without health insurance coverage poses a risk to both your potential to get care and an even bigger risk to your personal finances, explains Noah Lang, Chief Executive Officer and co-founder of Stride Health, a benefits platform for independent workers. People who aren't insured or who are underinsured tend to be hesitant to get care, which can risk their health, he adds. People who have health insurance are often more likely to go to the doctor when they need to because they know what it will cost, says Katie Rodgers Turner, Executive Director of the Family Healthcare Foundation in Tampa Bay, Florida. They tend to follow up on medical concerns their doctors flag, such as high blood pressure, before they turn into bigger problems, and they're more likely to obtain necessary prescription drugs since they're available at a more affordable rate. Health insurance coverage: all health insurance plans sold on the federal marketplace are compliant with the Affordable Care Act, ACA, meaning they cover a set of 10 categories of services. These essential benefits that must be covered include outpatient care, emergency services, hospitalization, such as for surgery and/or overnight stays, pregnancy, maternity and newborn care before and after birth, mental health care and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices for those with disabilities, injuries or chronic conditions, laboratory services, preventative and wellness services, including cervical cancer screening and HIV screening and counseling, pediatric services, including vision and dental care. Outside these essential benefits, what a plan covers will vary, which is why it's important to read the fine print. How much does health insurance cost? The cost of health insurance varies dramatically, but certain factors might increase or lower your costs. According to healthcare.gov, the 5 things that can increase your monthly premium are: your age. Premiums can be as much as 3 times higher for older people compared to younger enrollees. Your location. Where you live impacts your premium, depending on factors like cost of living and state rules. Tobacco use. People who use tobacco products can be charged up to 50% more compared to those who don't. Whether you're seeking coverage as an individual or for a family. If you're signing up for a plan that will also cover dependents, expect to be charged more. Your plan category. There are 4 different, metal tiers, of plans you can choose from: bronze, silver, gold and platinum. These categories determine how you split your costs with your insurer. For example, bronze plans typically have lower monthly premiums and higher out-of-pocket costs than the other tiers, and platinum plans tend to have the highest premiums with the lowest out-of-pocket costs. While health insurance is generally considered very expensive, there are ways to get help with paying for your coverage, says Lang. A recent Stride survey found 80% of uninsured gig workers who didn't think they could afford health insurance weren't aware of tax credits that could assist with low-cost coverage. The American Rescue Plan Act of 2021, also called the COVID-19 stimulus package, has made insurance much more affordable, he adds. Stride data shows nearly 40% of gig workers who enrolled in health insurance in 2021 were paying less than $1 a month. The ACA offers financial assistance that reduces monthly premiums and out-of-pocket costs to help make health insurance more affordable. Premium tax credits, for example, are based on household income. You probably qualify for assistance, says Lang. With the American Rescue Plan Act of 2021, Americans who previously qualified for subsidies are eligible for more money, and people who weren't able to qualify previously now can, he adds. How to choose the best health insurance for you? There are some questions to ask yourself to ensure you're choosing the best health insurance plan for you, including what will your total costs be? In addition to the monthly premium you pay your insurance company, consider your deductible and what your out-of-pocket costs might look like. Some people would like to have premiums as cheap as possible and are fine with a higher deductible, says Turner, while others prefer the opposite. Are your favorite doctors in network? Each insurance company works with a certain network of providers. Before signing up for a plan, ensure that the doctors you want to see are included in the plan's network. As a mom, I don't ever want to have my pediatrician not be in my network, says Moore. If you love your OBGYN or your family practice doctor, find out if they're in network before you sign up, because it can make all the difference. What type of plan is it? If you sign up for a Health Maintenance Organization (HMO) plan, you generally won't be covered if you seek out-of-network care unless it's an emergency. If you pick a point of service POS plan, you'll be required to get a referral from your primary care physician in order to see a specialist. The kind of plan you choose will affect your out-of-pocket costs. If you're struggling to figure out which plan is best for you, Turner suggests seeking the assistance of a health insurance navigator. These trained professionals can help you figure out if you qualify for any financial assistance and compare plans. To find a health insurance navigator, go to healthcare.gov and enter your zip code. These services are free, confidential and available to the public around the country, says Turner. Another option is to contact a health insurance broker. Doing so is typically free since they're paid by health insurers, says Moore. It's really no risk to you to reach out, she adds, and it can be a helpful way to feel more confident in your decision. Methodology to determine the best health insurance companies. The Forbes Health editorial team evaluated insurance companies that offer plans nationwide in terms of how many states in which they provide coverage, size of provider network, number of plan types available, lowest costs available in terms of physician and specialist copays, though they vary from plan to plan. How agencies like AM Best rank them in terms of their financial health,